Z-codes are an important part of the diagnosing process in medical billing. If you want to pause here and look back at my last video, you should do that right now. Otherwise, if you've already seen it or just don't feel like opening up another tab, I'll quickly go over what a Z-code is for you again. These codes are a subcategory of the International Classification of Diseases Clinical Modification System, or ICD-CM, which is a pillar in the field of medical documentation and coding. Z-codes capture and document a wide variety of non-diagnostic factors that directly influence a patient's health status. This includes social, economic, and environmental factors. The intention for these codes is to ensure your patient receives the necessary attention depending on their particular circumstances. Let's go over some Z-codes you will likely find yourself running into. Hi everyone, I'm Maria from eTactics, and today I'm going to go over 5 different Z-code categories. Before I get started, make sure you subscribe to our YouTube channel by clicking the button below. Also, don't be afraid to hit that alert bell icon so that when we post new, helpful content, you get notified. Number 1, contact and exposure. This category indicates the suspected contact or exposure to either communicable diseases or other hazards to someone's health. The Z-code is for patients suspected of having contact with disease through close proximity with an infected individual or in an area where disease is an epidemic. These codes can be a first listed code or, more commonly, a secondary code. First listed contact or exposure codes explain an encounter for testing, while secondary codes identify a potential risk. Number 2, inoculations and vaccines. Codes regarding visits having to do with inoculations and vaccines suggest that a patient is being seen for preventative vaccinations. Procedure codes must explain what the administration of the injection is, as well as the type of immunization used. If the inoculation is a part of a routine preventative healthcare service, the Z-code is likely to be a secondary code. Number 3, status. Status Z-codes suggest that a patient is a current carrier of a disease or has the residual of a past disease. This includes things such as prosthetic devices, which are resulting from a past treatment. This Z-code is important as it can help a provider deliver the best course of treatment and outcome. However, note that a status code is different from a history code, as history codes indicate a patient who no longer has the condition. Number 4, history. There are 2 types of history codes, personal and family. Personal history codes help explain an individual's past condition that they no longer have. This patient is thus not receiving treatment, but note that the condition does have the potential to return. Personal history codes are often conjoined with follow-up codes. A family history code is necessary when the individual has family members who have the condition in question. This increases the likelihood of the patient contracting the disease and thus requires monitoring. These can partner with screening codes to explain the need for a test or procedure. History codes are appropriate to include on any medical record. And number 5, screening. Screening Z-codes state that a patient is going through testing for a suspected disease or disease precursors. These patients are seemingly well individuals. These tests are important for early detection so that treatment is available for the patient for the best possible outcome. If the patient presents symptoms, then this is not a screening, but instead a diagnostic exam. Screening codes are a first listed code if the visit is only for a screening exam. When the visit is for any other reason with a screening performed additionally, it is then an additional code. Screening Z-codes are not necessary for screenings that are a part of a routine visit. An example might include a pap smear done during a routine pelvic exam. There are approximately 12 more Z-code categories for us to go over, so make sure you tune in for my next video. And remember that contributions to improved patient care, resource allocation, and research are all made possible by continuing your education no matter what your role is in the healthcare system. If you'd like to learn more about Z-codes, reach out to eTactics. And since you've made it this far, give this video a like, a comment, and share it with your friends.